tied up with a AI company to help analyze your skin remotely, or we can do it in clinic if you prefer the face-to-face approach. Hello and welcome to another edition of the Vysana newsletter. I'm Dr. Dhesi here in clinic. I was going to do this one outside, but I chickened out. It's cold, it's raining, but the sun's always shining in clinic. So what do I have in store for you this week? So I wanted to talk or tell you a little bit about how we've been helping some private medical patients in my capacity as a private GP. As always, we'll do a little bit of talk about skin and what we're seeing in clinic. And I also want to share a very exciting innovation that has taken some time. I've been working very hard with some colleagues where we want to enhance our virtual skincare service. So skin is where we start and then we work our way within. It's a holistic approach. So what we have developed is a kind of remote questionnaire and quiz. We've tied up with a AI company to help analyze your skin remotely, or we can do it in clinic if you prefer the face-to-face approach. And then we can send you a more bespoke skincare plan, or we can book in for a virtual consultation. So really reaching out from clinic and connecting with you, our patients, those of you who know us. And if you have just started watching the YouTube channel, then obviously you can click on the link when we do provide it, and you will be able to engage with us on a virtual basis. So I will share that with you today, so please carry on watching. So firstly, medicine has always been a passion in my life. So I graduated from St. George's Medical School in 2006. Before that, I did a degree in human physiology at UCL, University College London, and very much interested in science, how the body works, how people work. That naturally translated into doing medicine. And although where we started, Vysana offers a aesthetics focused clinic, what my goal and my passion is longevity medicine, where we incorporate all those elements. If we do start with skin, we work our way within. And as time has gone on and more patients have come into clinic, the focus has been on women's health, but we do see men as well. I believe that millions of women are failed globally by broken healthcare systems, not people. I think doctors, healthcare practitioners that are out there are doing an amazing job, but the systems are broken. The systems are designed to acutely treat disease. And obviously, if you have cancer, if you have a broken bone, if you're unwell with an infection, of course, treatment is what we want to deliver. But prevention is better than cure, and that's what longevity medicine is about. So our initial phase, our mission is to mainly help women, guide women through menopause with mindfulness and medicine. And that doesn't mean, though, that we can't see other patients as well, men included. So firstly, I was going to tell you a little bit about clinic and private medicine. So what have I seen in private medicine this week? Well, we saw a patient who had what they had felt was acute upper abdominal pain. Remember, anything that I talk about now is not medical advice. It is it's a conversation. It's a social education. So we had a patient who last week had experienced upper abdominal pain, had gone to out of hours, gone to hospital. It wasn't chest pain like it had been thought of. All her cardiac markers, her ECG, everything was normal. So she wanted to come into clinic and discuss it. So we did a full examination, we did a full history. And it turned out that it was actually upper abdominal pain. And in a patient that's young, it's kind of hard to decipher where things lie. Is it lifestyle? Is it diet? She'd been traveling for work. She got dehydrated. So a couple of differential diagnoses came in. Obviously, for many women, urinary tract infections can occur, and they can occur in different ways. They tend to be lower abdominal. You can get kidney stones. They can present as upper abdominal pain and colicky pain. Sometimes people describe kidney stone pain as equivalent to labour pain. Obviously, I don't know that as a man, so please, no comments in regards to. I'm not saying that I'm comparing it. Some people have mentioned that it's like that. The pain intensity is high. So long and short of it is that we went through a full examination and we wrote a referral guidance for that patient to her insurer, recommending that she has some investigations around her kidneys, that potentially she got dehydrated. If she has got existing kidney stones, that results in colicky pain. So like I said, it's not a diagnosis for you watching now. It's just one of those things that we were doing in clinic. People are interested in what are you doing in clinic. Private medicine, we're not sure about that. Obviously, we can do blood tests as well. We do more screening blood tests, but we can do acute blood tests. We work with a partner called Nationwide Pathology, and they send patients in all the time to get things like their hepatitis B status checked, if they're healthcare practitioners or their liver function checked. Lots of blood tests. It's a minefield out there. I'm here to provide guidance. Another patient that we had was actually a male patient, much older, and had got some blood test results from the GP. The GP said they were going to sort it, organise things, and sometimes that can take time in the NHS. Now, if you've got resources at your disposal, like private medical insurance, that's what I can provide here. So we went through their whole history, went through the blood test. The blood test was a marker for congestive cardiac failure. As I know, in the NHS, it can take weeks to months to get all those investigations done. You need an echocardiogram, you need an ECG, you need further blood tests, including kidney function, you need a full examination. So they were within a week able to see a cardiologist who's a specialist in congestive cardiac failure, not just a general cardiologist, someone who actually specialises and trained in congestive cardiac failure. And that patient now is getting that all done before they go away on business again. So again, it's about not necessarily looking at the service we provide in the traditional sense. Of course, for our existing patients, if you think you've got a chest infection and unwell, and we have gaps available in the day, of course we'd like to see you. But this is more about prevention. This is about the passion that I have in order to prevent disease rather than experiencing it. And when you do experiencing it, I'm here to provide that service. So that was our private GP moment, me sharing that with you. I hope you found it useful. If you are interested, please do call us on our number. It's not an emergency number, or email us at information@vysana.com. You can also go online at vysana.com and book in online for a consultation. So as always, skin is the focus when people come in. It's the thing that, you catch me staring at you. Is this new? Is this blemish new? What's been happening? You're getting breakouts. So just because we haven't seen you for a while doesn't mean I'm not thinking about you. And I'm going to tell you a little bit more about our new service coming in. But what have we noticed? It's the temperamental weather. It's the temperamental weather changes. You've got stress on your hands. If you've got kids, they're tired. A lot of upper respiratory tract infections going around like cold and flu. That can put stress on your body, not sleeping well, especially if you're perimenopausal, menopausal. As always, when you're coming in, I do go through those symptoms with you. But we see that manifestation in skin. And what are we noticing most? It is red, blotchy, irritated, sensitive skin. Patients come in and they say, I can't have this treatment, or they message in and cancel appointment, reschedule, because my skin's sensitive. My skin's sensitive right now. It reacts to everything. But the question you have to ask yourself, why is your skin sensitive? Are you using the right products? Are you layering products? Are you providing nourishment and hydration? Are you preventing barrier function loss? And I would just give you a little tip today. If your skin is itchy and flaky, it is dry, that needs moisturizing and possibly some serum type repair as well. If your skin feels tight, especially when you come out the shower, skin feels a bit tight, not necessarily sore, but tight, your skin is dehydrated. It doesn't matter how much water you drink, you need to repair the barrier function of your skin. So if you can't get it repaired with using a good serum, not anything that's exfoliative, more nourishment, obviously hyaluronic acid serums work. And if you're using a good barrier function moisturizer, not water-based, E45 just won't cut it at this time of year. If it's not working, then obviously reach out to us in clinic. Microneedling can help, Profilo can help, and there are lots of other treatments. Again, if your skin is itchy and flaky, that's dry, it still needs nourishment. If your skin is tight, especially after showering, then it's dehydrated. In both cases, you need layering up of products. If you need more information, contact us at information@vysana.com. So I'm very excited to give you a little bit of a teaser about our skin service. So you fill out a questionnaire online, you click on the link, you fill out a questionnaire online, it's a quiz, it identifies what some of your specific problems are. Obviously, we're concentrating on perimenopausal and menopausal skin. You then send that back to us. And normally these things disappear and you wait ages to hear back. But this time you will get an automatic email response with a link for our AI solution where you can log in. We will send you a login details, a password and username. Then you can access the skin analysis tool. You'll be able to scan your face with that tool. Download the report for us. This is where GDPR and compliance can get a bit difficult. So download that and email it back to us with the email that you used in the type form, and then you'll get an automatic response, and you can choose. You can either go to our shop and look at some products, you can purchase a remote skincare plan where we can review what you've said, and also, as always, you can see yours truly for a virtual skincare consultation if you're interested. If this has piqued your attention, if this has got you interested, like, oh, I'd like to try that out, drop us an email at information@vysana.com or reply back to this if you're watching it on the newsletter. If you're watching on YouTube, email us or include a comment, put in there virtual skin, or just comment, I will pick it up. And as we roll this out, probably in the next newsletter, we'll just share the link directly. But if you want to be one of those first people to try it out, then please do email us, comment if you're watching on YouTube, and we'll be happy to share it and really get your feedback on this, because I think it's going to be a game changer. Skin is what we look at in the mirror. You wake up first thing in the morning. What do you see in the mirror? What bothers you? I want you to feel great. I want you to feel powerful. I want you to be adding value to all those around you. And this is me, Dr. Sunny Dhesi. This is Vysana Life. Thank you for watching the newsletter, and I look forward to sharing more hints and tips with you soon.